Hi, well, Community Focus here on Channel 6 TV. Glad you could join us tonight. I'm Kenny Fogel. We're going to talk a little bit about health today, and hopefully you'll join in and learn a little bit. And if you like what you hear today, well, we're going to tell you how you can learn a little bit more. We've got Bobby Harnett here and Maggie Smith, and they're from the Kentucky One Health, and they're going to tell you a little bit about what's going on in our community. And first of all, welcome to the show.
Thanks, Kenny. I appreciate you having us.
Well, Bobby, what's going on right now?
Well, I just want to talk a little bit about being proactive in your health care, and a lot of that has to do with cancer screenings, cardiovascular screenings, blood pressure checks, and that kind of thing. We just finished up with Heart Healthy Month in February for women, and we had a big kickoff on that. It was very successful, and we're getting ready to go into March, which is Colon Cancer Awareness Month. So we have to wear blue in March for colon cancer awareness, and we are encouraging folks to take a proactive approach to their health care and get their colonoscopy screenings. Women and men at the age of 50 should begin with their colonoscopy screenings, and your primary care physician can order that for you. And then once they do that colonoscopy, depending on what they find, they will let you know when you need follow-up colonoscopies. It is amazing, the statistics for colon cancer survivors. 9 out of 10 colon cancers are curable.
Why?
Because the colonoscopies, because they are detected early. Many times they start off with a little bump in your colon called a polyp, which sounds really weird. But on that colonoscopy, if they find that polyp, they can remove that at that time, and then they can test it. A lot of times, they don't even need to do any additional surgery if it's very precancerous, or they can go in, remove a part of the colon if it's very early stage. And then if it's later stage, you may have to have some chemotherapy. But early detection is the key for cancer survival.
I guess that's the question is once you start having symptoms, is it too late then, or is it basically,
It's never too late. Always consult your primary care physician, and they will let you know what the next steps are. We are a multidisciplinary clinic at Flagey Cancer Center, which is in the medical office building right next to the hospital. It's on the first floor. We have medical oncology, radiation oncology right here in Bardstown. Dr. Monty Martin is our medical oncologist. He's also a hematologist, which is a blood specialist. So if you have abnormal blood counts, or if you need your blood thinned because your blood's too thick, you have clots in your legs, any of that managed, Dr. Martin can do that. And then Dr. Joseph Shaughnessy is our radiation oncologist, and we do radiation right there on site. So we can take care of all of your needs right there in one building. I'm going to let Maggie talk a little bit about what she does. She has a very special role, and it's kind of a unique role to cancer care all over the world, and it's called nurse navigation. So Maggie, you want to tell a little bit about what you do every day?
Sure. I'm the nurse navigator at Flagey Cancer Center, and my goal is to support the patient from the point of diagnosis or from the point of recognition of an abnormality, support them all the way through to survivorship. And cancer survivorship means a lot of things these days. But we support them all the way through to the end of their treatment or beyond, whatever that may be. We support them through all the diagnostic testing, whether they have to have biopsies, their chemo treatments, their radiation treatments. We follow them as they go to other physicians for care, because a lot of times cancer care goes beyond the medical and radiation oncologists and into the surgeons and things like that. And it's easy to fall through the cracks. So that's one of the goals, is to stay with them and support them through all of those visits. Another part of my role is to help eliminate barriers to cancer care. A lot of times patients might have issues with transportation, getting to and from their appointments. They might have financial issues, home care issues, psychosocial issues, and that go along with cancer diagnosis, like depression or anxiety. So I'm kind of their contact at the office to say, hey, I'm having problems. So we help to mitigate those barriers, remove them, so that they can get the care that they need.
Well, one word you just popped up 2 or 3 times in our interview already is survivorship. And that's something you didn't hear about a few years ago with cancer. Is that cancer becoming more survivable, or is this something that, are we eliminating cancer, or are we coming close? What's happening?
I can't say that we're eliminating, getting rid of cancer, but we're diagnosing early. I cannot say that enough. You'll hear it multiple times through this interview. You have to detect the cancer, the tumor early in order to treat it. And the treatment at the earlier stages is much easier to overcome than in the late stages. The complications are less. There's been so much focus on breast cancer that there are a lot more breast cancer survivors because those ladies are getting those mammograms at the age of 40. They're getting them every year. They're diligent about it. So we're detecting it early. We're giving them all the tools that they need to take good care of themselves. Colon cancer is very curable as well. You don't hear as much about it, but it is a cancer that affects men and women equally.
Now that used to be at 60. Now it's, you say that's moved that up to 50.
Yes,
now.
sir. They start at 50. Some folks may have to have it every year if they have a strong family history.
That's my next question is, why often should you have this?
Well, the physician that does the colonoscopy will let you know. If they find polyps, those funky little bumps in your colon, or if they find multiple, if your mom, dad, brothers, or sisters have had colon cancer in the past, that's also an indicator that you might need it more frequently. But typically, if it's normal, they didn't find a lot, it's 5 years. Sometimes it can even go up to 10 years. So your physician will let you know that. And these are awesome questions to ask your primary doctor every year when you go in to see them. Is it time for me to have that colonoscopy? Women need to have that mammogram at the age of 40. They need to have that every year. Unless they have a real strong history of breast cancer in their family, they may even need to start earlier. So that's just kind of a guideline, but you definitely need to talk to your primary care physician. I will mention something new in cancer care, and it's called a low-dose CAT scan, okay? So it is detect lung cancer early. Kentucky is #1 in lung cancer deaths. We don't want to be #1
We want to be number one in a lot of things, but not
That's right. In basketball, football.
Basketball, football.
But not in lung cancer. So Kentucky 1 has really pushed hard to promote this low-dose CAT scan. They've gone all the way up to the legislators to get this passed so that our insurance will pay for it. Insurance will pay for mammograms. They'll pay for colonoscopies. They need to pay for these low-dose CAT scans.
Well, that was my next question. I was going to, Maggie was talking sort of a few minutes ago, you talked about the whole system. You know, there's so many parts to the cancer. And that's what I wanted to touch on. Is it very expensive, and does insurance cover most of this?
It's absolutely expensive. We have billing coordinators, financial assistants, people at the hospital, and across Kentucky One Health who help us with this. We make sure that insurances are covering the services that we're providing because it is expensive, and patients end up with a big out-of-pocket expense at the end of all of this, regardless of their insurance. So we try to make sure that everything we're doing is pre-authorized, that we're covering all of this, and we do have resources out there that help patients through that financial process.
But that's basic insurance. I know some people have cancer insurance above and beyond that. I don't know all the details of that, but I'm sure.
But all the screenings that we're really trying to promote folks to do are covered by your insurance. So it should not be out of pocket.
Screening is basically the first step. They should basically.
And that will help detect the cancer early so that your survival rate is high.
And it does save money. The earlier you can detect cancer, it saves money.
So I know you got something coming up here, Willisburg, pretty quick.
Yes, so you know we do a lot of events right here locally in Bardstown. We have the big health fair at the hospital, and we wanted to provide some outreach to the outlying counties and communities. So Kentucky One Primary Care is located in Willisburg. Miss Connie Pate is a nurse practitioner there and runs that office and does a fantastic job. I've done a health fair there before, and it was very successful. So we're going to do that again in March. We're going to have, it's kind of like a little mini health fair in her office on March 24th from 9 a.m. to 12 noon. Her office is located 2387 Main Street, and that is in Willisburg. We're going to do blood pressure checks. We're going to do your oxygen level check your blood sugar if you need that done. We're going to see if you're eligible for that low-dose CAT scan. We're going to talk to you about those colonoscopies for colon cancer awareness. We're actually going to have the FIT test where you can take those home, put a stool specimen on there, send it in. If they detect any blood on that, they'll let you know and see if we can go ahead and get that colonoscopy scheduled. That is one of the signs, a potential sign for colon cancer is blood in the stool. We could also do some clinical breast exams there. So there's going to be a variety of things that we're going to have available. We really want to encourage folks to come out. You don't need an appointment. We're going to have door prizes, refreshments, some giveaways. So we really would like for everybody around the Springfield-Willisburg area to take advantage of this opportunity. It's totally free. You can call if you have any questions on where the office is located, or if you didn't get everything that I just said of what we're going to offer, at 859-375-0110. Or if you have any questions in your local, you can call us at the Flagey Cancer Center at 502-350-5655. 5700. If you're interested in scheduling an appointment at the Cancer Center just because you have questions or maybe you do have a blood disorder, we take self-referrals, so you can just give us a ring and we'll schedule an appointment. If you have been diagnosed or told that you have cancer, we try to get you in the very next day.
Okay. Now, last month was breast cancer. This month's colon cancer. Now, does every month have a cancer body part assigned to it?
It does. It does. Usually there's a couple. Some months have a couple, but yes.
Okay. Well, great. Well, I appreciate what you're all doing out there. It's fantastic because this war on cancer is something that I hope we win and win very soon.
We do too. We're trying to put ourselves out of business, Kenny.
Yeah, that's great. I'm glad you are. So again, Thursday, March the 24th over in Willisburg, 9 to noon. And we thank you all, Bobby and Maggie, for being here today and letting us know about this. And hopefully we have a lot of participation because that's what it's all about. I mean, again, like you said, most of us be paid for through insurance and things of that nature. And preventing is a whole lot better than what the alternative.
Absolutely. It's a huge positive and benefit for the entire community.
Okay. Well, thank you a lot for being here. And hopefully a lot of people take advantage of it. Thursday, March the 24th, 9 to noon at Willisburg. So again, if you're going to check on that, give them a call. It's at 859-375-0110. I'm Kenny Fogle. We'll be right back with more Community Focus on Channel 6 right after this.